So today we have a patient, John Williams, who's a 45-year-old male with a history of HIV. He underwent a cholecystectomy, which is the removal of a gallbladder, and they do that by making a small incision in the abdomen. He had the cholecystectomy 2 days ago. He is currently on ART and has been compliant with his medication regimen. But post-operatively, he has been experiencing nausea, vomiting, and severe pain. His vital signs are stable, but he is uncomfortable and distressed. Since John is post-op and he is experiencing pain, vomiting, and nausea, as a nurse, the assessments for plan of care, we would assess his pain level. So by doing that, we would ask the patient how he is feeling, if he's in any pain, and then if he could rate the pain on a scale from 1 to 10. We would then continue to monitor his vitals since he is post-op. We want to make sure that his blood pressure remains normal, which is 120/80, that his pulse continues to remain normal, so there's no signs of tachycardia or anything. We want his oxygen levels to continue to be above 92 to show that there is no signs of respiratory depression. And then we also want to make sure that even his respiratory is good. We would also assess the surgical area, which is on the abdomen. We want to make sure that it's not too tender, that it's not red or inflamed, any signs of pus or green or yellow discharge. Since he is experiencing nausea and vomiting, we would ask him, how he's feeling. Are you still experiencing any nausea, any vomiting? Is there anything that could be potentially triggering it? Like if he's vomiting more after he's taking his medicines, or if it's just reoccurring throughout the day. We would also assess his input and output and his fluid levels because he is vomiting. So we want to make sure that his electrolytes are balanced. We want to make sure that he is not dehydrated and is staying as hydrated as possible. And since he is vomiting, that's going to be excess output. So we do want to make sure that he is still having or being able to sustain, eating, swallowing, and keeping food down, because that does affect the healing process as well. So as long as a provider prescribes it, we would be giving John antiemetic drugs, which will treat the nausea and treating nausea and preventing nausea, and then we would also give him analgesic drugs, which will relieve the pain. So to assess the effectiveness of the medication, we would assess the pain level after giving them the pain medicine, typically about 30 minutes or so. We would also assess the nausea from the antiemetic drugs. We would say, are you currently experiencing any nausea? Have you vomited? And then we would also observe for side effects, because for the pain medicine, since he is post-op, most likely he would be given opioids. So we want to make sure that his O2 levels are still good, that he is breathing fine, his mental status is okay. And then we also want to make sure that the nausea and vomiting starts to decrease so that it doesn't affect his hydration levels. So some signs and symptoms that would require further medical evaluation would be continuing of the nausea and vomiting. Also his mental status, that would be one of the first symptoms. You want to make sure that the patient is alert and oriented times 4, that they are awake and they are conscious. We would also, there would be an increase of severe pain because of the incision. We would also want to make sure that there is no infection or inflammation on the incision site. Dehydration is also a huge indicator. Fever, chills is also a signs and symptoms. Also jaundice, and along with the dehydration, it would be dried mucous membranes, tachycardia, potentially hypotension. So when monitoring and managing potential post-operative infections, The main indicator if there is an infection would be the incision site. So we would continue to monitor the incision site and make sure there is no redness, inflammation, warmth to the touch. We also want, or any pus as well. We also want to monitor his white blood cell count and his platelet count to make sure that he is, his coagulation is fine and that he will not hemorrhage, and that for the white blood cells so that he can heal well, because those are affected because he is HIV positive. We also want to continue to administer his ART medications because we want to make sure that the virus is undetectable and doesn't affect the healing process as well. We also would want to ambulate him and continue to get his blood flowing. So some nursing interventions that we would do. Of course, we would administer the prescribed medications as ordered, along with, if he is still in pain after giving medications, we could reposition him to see if that would help him, put him in a more comfortable position. We would want to encourage that he stays hydrated and continues to drink water, because we do not want him to be dehydrated and have an electrolyte imbalance. We would also want to monitor his input and output, because since he is vomiting, his output might be more excess, and we want to make sure that we balance it out by having him continue to drink more water and staying hydrated. We would also want to monitor his blood count and his T cell levels to make sure that the ART meds are working and that there is no interactions with the medicines. So some possible causes of post-operative nausea and vomiting is the anesthesia. And pain medicine can cause nausea and vomiting, the ART side effects, and also the stress and the pain from the surgery. So some possible interactions between ART and the other post-op medicines he would be getting. So opioids and ART, the interaction could increase the opioids effect, which could potentially cause CNS depression and respiratory depression, which could lead to death. The antiemetic or the nausea medicine can interact with ART by increasing nausea and vomiting, which can also cause electrolyte imbalance, which hypokalemia is a major electrolyte imbalance from the two. The antibiotics can also hinder the effectiveness of ART and affect the T cell levels, which would affect the healing. And then NSAIDs, that if those interacted with the ART meds can cause GI issues such as bleeding and upset stomach, diarrhea, and more nausea. Educating the patient, especially on managing the nausea and pain at home, is extremely important. So first, we want to educate the patient to take pain medicine as prescribed. We do not want them to overdose on the medicine and take the pain medicine every time they feel pain. If it says every 4 hours, we want to encourage that, not every hour. We want to encourage eating small meals so that they don't overdo the nausea or vomiting or trigger it. And then we also want them to stay hydrated. We would teach them to use relaxation techniques such as deep breathing, anything that can calm them. We want to educate them on the signs of infection such as redness, warmth to touch, any signs of discharge, and to contact the provider as soon as possible if they see any signs of infection. And then we would also want them to adhere to their medications for ART to prevent any further HIV complications, but we also want them to adhere to all their medications. So we would have collaborations with the physician. We would do the pharmacist if to do for their medicines, if they need any medication changes, or if they're having side effects, or if they're not liking the medicine or feel like it's not working for them. We would inform the pharmacist. We would want them to collaborate with a nutritionist to make sure that they are on the correct diet that would help promote healing or to help eliminate the nausea or vomiting. We would want them to do small meals, bland meals. We would also collaborate with a physical therapist so that we can prevent blood clots and make sure that they can continue their ADLs and don't have issues ambulating. And also social work to help promote any resources that they may need, to make sure that coming home, their home is okay, that it doesn't prevent any like fall factors, and make sure that they're coming home to a safe environment. So patients, for any post-op care, and especially having HIV, they will have emotional and psychological needs. So first, we would always want to acknowledge and validate the patient's concerns. We would want to active listen and use therapeutic communication. If they do need counseling or show any signs and symptoms of depression, anxiety, we would want to collaborate with a counselor to make sure that they're getting the help that they need. We would want to encourage them to have a support system. You know, it's never bad to ask for help, and help can help alleviate the stress that they may encounter. And then we also want to educate the patient on the importance of self-care and taking care of themselves and making them feel like they're not alone. Some key considerations for the discharge plan is to assess the patient's ability to swallow the medication, especially if they're having any nausea or vomiting. We want to make sure that they are able to keep the medicine down, whether it's the antibiotics, the ART medicine, the pain medicine, because those medicines are only going to help the patient heal and help them be as comfortable as possible. We want to educate the patient on the incision care, any signs of infections, or also pain management. We want to collaborate with the follow-up appointment with the surgeon or HIV specialist. We want to educate the patient on over-the-counter medications. Most of the time, it's not good to take over-the-counter medications when dealing with all these other antibiotics and ART meds. And we also want to reinforce the importance of continuing their ART medication along with any other medication that they are given.